Welcome to the Insight series on personal well-being. Our question for this week is Wellness Big 10. What about pandemic preparedness? Number 20. What about pandemic preparedness? According to the CDC, everyone should be preparing for another round of pandemic flu, and the source of that is the CDC's National Pandemic Strategy. During the 2019 to 2023 COVID-19 pandemic, many people experienced severe medical problems and/or death. Those that died or had serious medical complications usually had one or more of the following risk factors. Those risk factors include over age 65, immunologically compromised, certain disabilities, and having one or more of the following health conditions: asthma, hematologic cancers, cerebral vascular disease, chronic kidney disease, chronic lung disease, chronic liver disease, cystic fibrosis, diabetes mellitus 1 or 2, heart disease, HIV, mood disorders, schizophrenia, dementia, obesity, physical activity, pregnancy, smoker, transplant, organ recipient, tuberculosis, and immunosuppressive medication user. To the extent that you can reduce the prevalence and/or severity of these risk factors and conditions, you'll likely benefit in any future pandemic. And also notice that we have among these areas a lot of the risk factors that we look at in wellness: obesity, physical inactivity, smoking. Those are the main ones that we tend to look at. Nutrition is also going to affect immune system function. So if that nutrition is suffering, then the immune system is likely to suffer. In addition, the more of these risk factors you have, and the more severe, the more rigorous your preventive actions and steps need to be. And I recommend that you prepare your own personal COVID-19 plan. Make a COVID-19 plan into your browser, download it from the blank template from CDC, and then fill it out. Focus heavily on the personal and family protection elements. Scope out the vaccine issues, but be very careful. Now, another thing you can do is to take home and take some actions at home to strengthen your immune system. These include the following foods and dietary supplements recommended by WebMD: vitamin A and garlic, bromelain, omega-3 fatty acids, vitamin D, ginger, vitamin E, resveratrol, zinc, and then always be prepared about extreme stress. Avoid extreme stress and avoid lots of alcohol and becoming very tired out. Those are the things that weaken our immune system's function. Lastly, be sure and take precautions to reduce your risk of exposure to the active virus from ill people. You want to wash your hands frequently, and that's 20 seconds per washing. Wear a mask, avoid contact with those with symptoms, and follow your COVID plan. In summary, pandemic preparedness is extremely important to our future health, and there are a number of things we can do to help maintain that future health while protecting ourselves and our family members. Now, for more information on this topic, put these terms into your web browser search engine: preventing infection from COVID, avoiding pandemic threats, how to reduce your risk of respiratory infections. And that includes all respiratory infections, but particularly those that tend to have a pandemic role. Next week, we will address the question, Wellness Big Ten, what is a good general attitude to have about your health and well-being? We encourage you to live well, live wise, live long.